Welcome back to AM Northwest. Would you like to erase wrinkles and lift sagging skin, especially under the chin and on the neck? Then your best bet just might be a surgical facelift. Here to tell us why, we welcome from Portland Laser and Surgery Center, board-certified facial plastic surgeon Dr. David McKilkey and his patient Pam Town. Good to have you both with us.
Yeah, thanks, Helen. Thanks.
So isn't the way to get rid of the neck is just to do this?
Yes.
Yeah, I mean, temporarily. I mean, you can kind of do this and this. But,
So it's a surgical facelift, but not a full facelift.
yeah, I think facelifts are so confusing because a lot of times if your aunt or somebody you know has a facelift, a lot of times they'll also have eye surgery or forehead surgery or something, so their whole face changes.
Right.
And really a facelift is the lower part of your face, and a lot of times it'll be labeled a neck lift because really what you're doing is getting rid of this part down
Which
here.
changes your whole face, really.
It does, but in sort of a nice way, because when people look at you, they recognize your eyes, they recognize your mouth. That doesn't change, so you still look like you. It's just that you get rid of this, so you look healthier, you look fitter, and you look younger.
Pam, now you didn't like the way your neck looked, right? Your grandson was grabbing it.
Yes.
It's kind
and
of
he
a,
was
a pull-up
like,
bar.
oh
For
my.
We have a before and after picture. Let's take a look. There we go.
And you did this as a present for yourself?
It was for my 70th birthday in August, and
That looks I mean, you look fantastic. And how do you
Wait a minute,
feel
you're
now?
not 70 now, are you?
Yeah.
yes,
Isn't that incredible?
That's incredible.
So when you look in the mirror, how do you feel now?
I love it. I especially like it from the side view because that was the most noticeable. As David said, you know, it picks this all up.
Yeah.
So.
And Dr. McGilkey, if you do a lift, obviously there's got to be an incision. Where is the scar?
And Pam's a great example because people with short hair or people that have thinning hair, a lot of times they have a hard time hiding that. And the incision goes right in front of the ear and then behind the ear and along the hairline, and it basically disappears because it's in natural creases.
Right.
I was worried about that because my hair was so short, and it's.
And I don't think anybody
you
notices.
can see it.
We sort of outed Pam here. I don't think people know.
Well, you're right. It looks natural. It doesn't look like one of those facelifts you see on television with a lot of actresses looking so fake now.
Right.
Which
This
is what I
looks
didn't
completely
want.
natural.
This is the same idea of before and after, but with the front view. And so you can see that remarkable difference.
Yeah, if you notice, I mean, her face looks the same. It's just that those cords in her neck are gone.
How long is the recovery?
What would you say, Pam?
I'd say give yourself 2 weeks to not really appear anywhere, but a week is, you're fine. I actually went to well, it was a funeral, so it wasn't a fun thing, but I went 6 days after.
I know we have other before and afters we'd like to show, so let's take a look at some of those. And Dr. McGilkey, tell me about these.
Sure. And the one thing that is important is it's not just women that are having this done. And this is a male patient that we had who his neck was just very large and made it look much more overweight, much less healthy than he really was. And doing liposuction and a neck lift really gives him a much better profile. And even though he didn't lose weight, he looks like his
he looks like he lost weight.
Yeah.
And again, here's a front view too. Same idea, same kind of procedure here.
Yeah, and he had a neck lift and a lower eyelid lift. And the thing with this guy, he's a marathon runner who is in great shape. He's in his 60s, but having a saggy neck makes him look less youthful. So doing this is a really nice thing for people because it makes them look as young as they feel and as active as they feel.
And it really looks more natural than a lot of things you see on television. A lot of these Hollywood starlets look frightening. You've got a seminar coming up. We've got a screen of it now. It's going to be Thursday, 6:30 to 8 o'clock.
Yeah, and it's in the evening over at Providence St. Vincent's Medical Center. And it's a great time for people to come that are interested in these type of procedures but aren't quite ready to schedule an appointment. It's really nice to sit in the back of the room and watch all these things and answer a lot of your questions.
And just find out more.
Yeah.
Absolutely.
Very good. All right. And we'll have that information on our website. We'll be back with more AM Northwest right after this.
Welcome back to AM Northwest Primetime, and we're back with Dr. David McGilkey from the Portland Laser and Surgery Center. And if a facelift seems too extreme, there are ways to use injections to relax wrinkles and fill in lines. But first, Dr. McGilkey, we wanted to talk about your special.
Yeah, it's sort of interesting now is the economic times have been hitting everybody, and everybody's looking for a reason to do something, and most people want a deal. And for the first time ever, we're actually offering $1,000 off of surgery that is scheduled by the end of the month, which is coming pretty quickly, and performed before the end of the year. And it's part of our way of just acknowledging that, these are times when people really do need a reason to do something, and this is our way of sort of giving back.
Very good. Okay. Let's talk about some other non-surgical kind of procedures. Botox. For where is that applicable?
I usually think of Botox as you want to relax muscles that cause frown lines or cause wrinkles in the forehead, cause crow's feet around the eyes. And filling in these lines is not really appropriate because you really want to relax them so you don't have that look. And if you look at this patient that we're showing here, those lines between her eyes make her look really concerned and make her look less friendly. And if you relax those, she looks much more friendly. You can tell she's even trying really hard to make those lines in the second photograph.
And she can't do it.
And she can, and she looks more approachable. She looks more friendly, and that's a great way to improve your look right before the holidays.
Also, Restylane. How does Restylane work?
Restylane is a filler, so you know, from a guy's standpoint, it's bathroom caulking. I mean, it's something that basically fills in lines or depressions. It's also it's a clear gel, so you can use it close to the surface. So it works very well for lines around the mouth. So this patient here, you can see before and right afterwards, she has those sort of parenthesis lines around the mouth. You can also use it to enhance lips, and you can make the lips slightly larger.
How long does that last, though, when you inject with Restylane?
Restylane is about 6 to 9 months. The other thing that's nice about Restylane is Restylane has an antidote. So if for some reason you do something and you just absolutely hate it, you can dissolve Restylane. Radius is another filler that we use, which lasts a little bit longer, but you can't dissolve it. So those are, you know, more for big volume filling. So cheeks, a lot of times you can use Radius on cheeks or for really deep lines. This woman here, when she was younger, had very prominent cheeks, and here she's seen before and right after with Radius, and you can see her cheekbones now are very prominent. It gives you back that sort of glamorous cheeks that basically are very youthful.
That's a remarkable.
Yeah, that looks great.
She you know, and she used a little bit of makeup on that the after, but a lot of times people don't think of it as their cheeks descending, but people lose volume over time.
Right.
You know, your face starts to lose that volume that makes you look young, makes you look healthy, and that can be replaced with a lot of different fillers.
When people come in and they see you for a consultation, will you suggest things to them? If they may come in with one idea, you may suggest another idea?
Yes and no. I mean, the last thing you want to do is have somebody come in that's thinking they want a facelift and tell them they have a big nose that needs to be fixed.
Oh,
no,
no. I mean,
you gotta be careful.
I was actually thinking the opposite.
Yeah.
And as a guy, yes, you have to be very careful. But I was just thinking, if someone comes in and says, I want a complete facelift, and you can say, you know, really, you don't need a facelift. How about we do just the pull up the chin or something here?
You know, the thing that makes people attractive is confidence. And if you can make people leave your office feeling that they look good, then they look great because they're smiling, they're not avoiding the camera, and they look confident. There's not one specific thing you can point to that makes them look better, but it's just that overall sense that they look better. So if you can find out what their goals are, then you can say, well, you know, gosh, you could do this, and that would give you what you're looking for.
Is everybody a good candidate for, like we talked earlier about the neck lift or facelift, or for Restylane or other kind of fillers? I mean, is it applicable to everybody, or are there certain situations where one is better than the other?
Yeah, definitely are certain situations where one is better than the other, or sometimes a combination, because they do such different things. You know, if time and money are no objects, you know, doing a surgical lifts remove excess tissue and it repositions tissue. But it doesn't take care of fine lines and wrinkles, and that's where things like Botox and fillers work. So sometimes people do a facelift that's sort of their foundation, if you will, and then decorate it, if you will, with the other injections.
If you do a lift, going back to that again,
You clearly are thinking about this. Yeah.
Somebody has seen his better days. I would imagine that's the most long-lasting. And at that point, again, the enemy is gravity and aging.
Yeah, I mean, surgery, you basically reset the clock, and then at that point, all the factors that got you to where you are now, you know, start to work again. So, but surgery is sort of a foundation, and I think a lot of times when you're looking at all these aesthetic options, and there's so many right now, a lot of times people say it's as good as a facelift, or it's like a facelift. The facelift is sort of the gold standard, and one thing we find at our clinics, facelifts people do really well with. They recover really quickly from. So why try to do something that is as good as a facelift when you can do a facelift? And then these other things are really good to help augment that, or if you're not quite ready for that. So I think there's a lot of great options out there.
We want to again mention to folks, if they'd like to check out the educational evening that you have scheduled from 6:30 to 8:30 on October 28th, they can do that. And as you said, just hide in the back and listen to the information and then make your decision from there.
There's a number to call for an RSVP. Make sure you get in on that. Good to see you again.
Yeah,
Thank
it's great
you,
seeing you
Doctor.
guys. Thank you very much.
We'll be right back with more AM Northwest Prime Time. Stay with us.